Hey, what's up, Feral and Ambulance Corps? Welcome back, episode 16. I'm John Barr, and today we're going to talk about what an EMS physician is, since some of you might be curious what I do. And also, I think you should know about this because as EMS physicians become more common, you might encounter them the next time you call for ALS. So let's get into it. Let's take a few moments to read the disclaimer. Okay, so what we're going to talk about today is first defining what an EMS physician is. I'll tell you about the path to become an EMS physician, and then I'll talk a little bit about how EMS physicians are different from EMS medical directors. So first of all, what is an EMS physician? So the term is sort of ill-defined, but I'll tell you the characteristics of what EMS physicians do. In common parlance, when you say you're an EMS physician, it generally means you do EMS activities, for example, such as respond to calls. And this is, you can see a picture of me here with our PennMed 1 unit, where I respond as a physician to calls in Pennsylvania. And what an EMS physician does when they respond to calls is they bring the additional knowledge and skills that a physician has to the scene. So we also, in addition to the skills, bring additional equipment and medications that a standard ALS unit could not provide. So some examples of that is I carry supplies to do chest tubes, blood products. We have video laryngoscopy. We have a ventilator. We have the ability to do a field amputation for an entrapped patient. We have additional medications, including some antibiotics, and various other different pieces of equipment that normally a regular ALS unit would not have. While we're out there, we can also provide on-scene medical control, and often we can give real-time teaching and feedback to the EMS professionals, the EMTs and paramedics who are on scene. And so usually when people say, hey, I'm an EMS physician, it usually means they respond to scenes in some capacity. Now, this is one way to become an EMS physician. This is the path that I took. So first, to become an EMS physician, you have to become a physician. So that involves getting your bachelor level degree, followed by your doctoral degree, or your MD or DO, and then you'll go to residency. Now, you can go to a number of different residency routes to become an EMS physician. By far and away, the most common is emergency medicine. However, some people become EMS physicians through pediatrics, and they become pediatric EMS physicians. I do see in some cases, especially in more rural areas, family medicine or internal medicine going through this. But for the most part, this is owned by emergency medicine, and this became an official board subspecialty certification in emergency medicine as of 2013. And to get that board certification in EMS specifically, you need to do EMS fellowship. Now, in the past, people who had lots of experience in EMS could grandfather in. That pathway is going away. And so going forward, it'll be fellowship trained EMS physicians who are out there running around to your scenes. So how does this differ from the EMS medical director? So you guys have probably heard of the medical director because you have one. Every EMS agency has one. And to understand what a medical director does, we need to understand something about the National Scope of Practice model for EMS. So in order for you to practice as an EMT or a paramedic, you need to, one, be trained how to do the work. So that's training and education. Then you need to be certified as competent. Now, this gets confusing because certified in this context refers to the legal definition of certification, which means you graduated from EMT school. That's different from your state certification because legally what your state certification is akin to is a state license. A license is a special privilege given to you by the state to do something. So for example, a driver's license gives you permission to drive a motor vehicle. Your EMT certification functions as your state license to practice EMS. Now what the medical director does is they credential you to practice EMS at your EMS agency specifically. So if you're credentialed to be at the Feral and Volunteer Ambulance Corps, you're not automatically credentialed to walk into some other ambulance corps and start practicing there. You need to be credentialed by the medical director at each specific agency you work for. The same is actually true for a physician. So physician, I'm, for example, credentialed to work at University of Pennsylvania, but other people are credentialed elsewhere. And I can't just walk into Jefferson or Hackensack Hospital or Valley or Holy Name and start doing emergency medicine, even though I'm fully educated, certified, and licensed. If I'm not credentialed, then I can't do that. So that is sort of the bare minimum that an EMS medical director has to do, is to do credentialing at the minimum. Many do more. So how does the EMS physician compare to being the medical director? So like I said, EMS physicians generally respond to scenes, bring their specialized knowledge and skills there, and can provide on-scene medical command. So we can give orders directly to paramedics on scene. EMS physicians may or may not be the medical director of an agency. For example, I'm not the medical director of the agency when I respond as an EMS physician. I'm actually right now not the medical director of any agency. So you can be an EMS physician without being a medical director. And EMS physicians also usually provide some sort of education. Often it's on-scene coaching, but it can be off-scene. In almost every shift, when I go out to do my PennMed 1 shifts, I usually do some sort of lecture as well. And EMS physicians, while often fellowship trained, don't necessarily have to be. There are many physicians who respond, for example, even on my agency, who are not fellowship trained specifically. And depending on your state, you may need a special certification. For example, Pennsylvania requires you to have a pre-hospital physician card. New Jersey you just need your medical license. So it's state by state, but often EMS physicians are fellowship trained now. The medical director, like I mentioned, has that minimum role of credentialing the EMS agency, but often does a lot more, such as quality assurance, continuous quality improvement, guideline and protocol development to guide what you do, provide education as well, and many medical directors are also EMS physicians. So you can be both, and many times the medical director is also an EMS physician, but not always. So with that, I hope that gives some additional clarity on what I do as an EMS physician. Maybe it gives you a little more insight if you happen to see a doctor on scene, what they might be doing or what they might be capable of doing. So if you guys have ever encountered an EMS physician or seen a doc on scene, let me know. I'd be curious to know what your experience was like and how it went down. So with that, stay safe. Happy holidays. See you next time.